pleasure to be back into this conversation. It's a pleasure to be engaging with you, and I'm glad that most of you are watching the videos, learning from them, and also sharing content back with me on how we can move forward. So today I'm going to talk about a very critical question that I was asked, and this is how the question came to me. I have an interest in research, but then my first opportunity after my internship has been in community pharmacy. How do I continue furthering my interest in research without missing out on opportunities by the virtue that I'm in community pharmacy? That's a critical question, and the reality of life is we might not get the opportunities that we want to practice in the fields that we desire, but we might find other opportunities that might not be linked to what we really envision that line of work to be. So in that question was posed to me, the question that I was asking myself is, if you're interested in research, what kind of research are you interested in? And the mention of organization that this person was talking about is like Cambridge Wellcome Trust, you're looking at the Africa Population Health Research Center and all that. And in my perspective, these are organizations that do a lot of operation implementation research and even policy related research work. So it's not lab related research, which means you are informing practice from a point of knowledge vantage information, knowledge analysis of that information, and positioning to address a social problem. So that came as a good question for me, and also a good guide, because I felt like this individual in their line of practice is well poised to actually do a lot more research with a focus on the community pharmacy practice setting where they are operating from, which is amazing for me, and it's an interesting discussion for me to have in this particular forum and in this video that I'm going to talk about today. So the first thing we have to acknowledge is research does not happen in isolation from every other domain of practice. Research is an in-depth in search for knowledge, and you're searching for knowledge, inquisition, you're being inquisitive. You're searching for knowledge, exploratory research, whatever it is. You're gaining more knowledge to be able to understand why things happen the way they are, what happens in that context, what problems are there. Then by having that basic understanding of what the situation is, finding deductive analysis so that you're able to imply and say, these are the contributing factors to this particular outcome. And therefore, this is the intervention that would be needed for us to close the gap in access to care in one way, or to make it easier for people to access care, or to reduce the risk of some problems. For example, I would give an example in this case of substandard and falsified medicines. Why do people get actually exposed to substandard and counterfeit medicines? Probably we don't have proper regulatory measures. Probably we have uncontrolled and actually a disintegrated supply chain. Therefore, I'm not guaranteed that I'm getting it from the right supplier across the value chain. All these are contributing factors. But what risk does it pose to the people who are using the medicine? Maybe they'll not get healed. Maybe it will be more harm to them. Actually, they suffer side effects or consequences as a result of that. Or maybe the cost of that care would be causing disability in them. There are so many other factors that could come into that conversation. And therefore, it is important for us to acknowledge, why are we doing research? Why are we interested in research? To address existing problems, to understand more, and to propose solutions and interventions that could make a difference. Guided by that understanding, then the question you ask yourself, when you're working in community pharmacy, what does your scope of practice entail? One, there will be David coming to you, just saying, I have a headache, it started on this particular day, the initial history taking. And in that history taking, you're able to write a prescription, or rather dispense medicines that are going to take care of the condition of the symptom that this person is feeling. That means you're already looking at the pharmacy only care for the patient, including self-care, and giving the information that would make them get the best value out of the care that you've given them. Other cases would be David already went to a physician or a clinician, got a prescription, but has been referred to you to get a dispensation of the medicines to be done at your pharmacy. In this case, this person has already guidance from a clinician or a physician, whoever it is, and you're coming in to review that prescription, understand their condition, and give them guidance and advice on how to use that medication. But at the same time, beyond treating the patient and dispensing the medicines as it is, you're also reviewing the prescription to understand, does it really correlate to the best outcomes that we would hope for this patient? Are the symptoms that the patient explains to you correlating with the outcomes of these? Does the symptoms correlate with the value or the therapeutic indication of the medicine that you're going to dispense to them? Those are key considerations that you can put into perspective. But you are the subject matter expert as a pharmacist working in the pharmacy setting, and you understand what works for the patient and what doesn't work for the patient. So you have to make that judgment call, and you have to decide on how you are going to take care of your patient, which is important. So in that research component also is you are reviewing prescriptions. Over time, probably you are in a malaria endemic region, and therefore most of the children coming in to the clinic or the pharmacy, whatever it is, would be coming prescription for anti-malarial medicine. Then over a period of time, you see a trend changing in the sense that even when you're doing your forecasting and supply, stocking and inventory management, you realize that over time we used to have more antimalarials. Now we are having more anti-diabetics, we are having more anti-typhoid medications, whatever it is that you're getting in. Why are we getting this new trend of medicines coming into our practice? And this is a conversation that I also had yesterday when I did an interview with one of our senior professors, Professor Jennifer, around research and also research in the community pharmacy. And in the last week, there has been a conversation among our forum as pharmacists, where we talk about pregabalin, and there are so many companies bringing pregabalin into our market. Why is that becoming a trend? As a community pharmacist, assuming you've not been used to having such kind of prescription with pregabalin for a month or so, then a subsequent month, a couple of them are coming. Then you now monitor and say, if I'm receiving prescriptions with this medicine A, how many physicians are prescribing it? Is it only one specific physician from a specific clinic, or there are more of them that are coming with the same prescription? And if it is more of them, then you need to ask yourself, what is the driving factor behind the prescription? Is it a pharmaceutical marketing trend where most pharmaceutical marketers are engaging with physicians to prescribe the medicines? Or there is a clinical problem that patients are suffering from that needs to be addressed and need to be investigated further? Or maybe it is a trend of habit where people have actually started prescribing it for out of specification, whatever, it's out of off-label indications for the medicine. We know that one key thing that is a current trend is pregabalin is indicated only in pain management for neuropathic pain. But you'd get to a point where patients are using these products not for the neuropathic pain, but rather it is pain that they have. It could be chronic or whatever it is, but they've gotten used to it. But there's also a tendency for people to abuse medications. Is that what's happening? So as a pharmacist working in community pharmacy, you need to understand, I am serving the community by giving them access to the medicine that they need. How do I make inference and actually understand the symptoms that they've come with, the medicine prescription that has been given, or the prescription that I'm going to write for them, and the medicine that I'm going to dispense? Is there a trend that I'm observing over a period of time? What are the drivers of this trend? How does it impact outcomes? And what are the enablers for it? Maybe you'd be told that if I go get pregabalin over the counter and I'm paying out of pocket, it would be expensive. But if it is prescribed for me, the insurance will pay. Is it value for money? If the insurance cannot pay for an alternative pain management drug, instead of having this neurological product that we have in pregabalin to be used instead, what can we argue for? Is it going to be an influence where you are shaping conversations on financing for care to be able to give lower pain management regimens, or are you going to go with what is already existing? It is upon you as a pharmacist at the community level to understand that research does not mean you must work in a research institution or organization, but it is about you applying your research knowledge, the mentality of a researcher, inquisitive mindset, critical thinking and questioning, problem solving, to understand what is it happening, why is it happening this way, and what alternative approaches can we take in addressing this problem. Once you establish that, it is about taking advantage of different resources and publication resources that are available to disseminate your findings. You can write it as an article and publish on your LinkedIn. Write it as an article, publish in different websites and publications. From the Pharmaceutical Society of Kenya, we have the Pharma Exchange, which is good for us in terms of monthly articles that we publish. But also there is the Pharmaceutical Society of Kenya Journal, so PJK. Therefore, if you do it as a research publication, then you can publish on that platform, which gives you the ability to build your research competency, and you're building a portfolio of work. If you look at the documentation video that I did last year, it's talking about documentation. If you build that portfolio, when you now want to transition from community pharmacy to a research institution that does a lot of research, you have the possibility and you have the evidence of your ability to translate research from just observations to critically analyze and presented facts in an article that would compel somebody based on your argument. That gives you the level. The other bit is exploring organizations that are researching on particular trends that you're observing. Currently, there's a lot of conversation on climate change and health, a lot of conversation on falsified and substandard medicine, but also conversations around antimicrobial resistance and related. What problems are you observing in the community? Can you do a research concept proposal, maybe 2-3 page document? Get some funding, and I know there's Royal Society of Infectious Medicines who is already currently having small grants, mini grants. You apply for that. As much as you're working as a community pharmacist, you're also doing a research project that is done through the platform you have working in community pharmacy practice. In so doing, you're building your profile, tapping into alternative revenue streams, in the sense that you're not only working in dispensing medicines, but you're dispensing medicines and internalizing the value of your ability to dispense and process prescriptions and offer clinical pharmaceutical care to the patient. That way, you're making a difference as a community pharmacist, and while at the same time not killing your interest in research, and that would be a game changer for your career and the profession that you're practicing in, which is the profession of pharmacy, where we all are, me and you in this case. On that note, if you find this video and this content I'm sharing valuable to you, I will encourage you to subscribe to the channel. I know we don't have many people following or subscribing. We have 26% of the viewers subscribing to the channel. If you can be one of the people who build the 26 to get to 30, that will be a win for us. If you find this video can be valuable to another person, I encourage you to share it with them. Let's build the movement of learning together, shaping the future, and working towards a better future altogether. Thank you, and have a good one.